This CMS National Training Program recorded webinar provides basic information on Medicare, Medicaid, the Children's Health Insurance Program, or CHIP, and the health insurance marketplace. You should always consult the relevant statutes, regulations, and rulings for official legal guidance. This is intended as an informational resource for partners. It isn't meant for press purposes and isn't on the record. If you're a member of the press, you can email press@cms.hhs.gov.
All right, welcome to today's virtual workshop, Medicare for People with Disabilities. I'm Sylvia Gary with the CMS National Training Program, or NTP. Now, I'm joined with my NTP colleagues today, Denise Denault, who will be providing technical assistance. And today's presenters are Tanya Duncan, the lead public affairs specialist with Social Security Administration, and David Santana with the NTP team. Now, for help with questions and answers, we have Melissa Simpson, the Assistant Director of Administration for Community Living's Office of Healthcare Information and Counseling. Thanks to everyone for your support in this event. And without further ado, I'd like to pass this on to Tanya Duncan. Tanya?
All right, well, good afternoon, but I am going to spend just a little bit of time with you all sharing some information about Social Security disability programs. So I'm going to turn my camera off and let's get started here. Okay, I'm going to go to here we go. So lesson one is going to be on the Social Security for people with disabilities. And at the end of this lesson, you should be able to define disability based on the Social Security Act, list the basic requirements to qualify for disability benefits, identify Social Security programs for people with disabilities, explain the disability decision process, and list some of the services that are available with the online My Social Security account. Now, let's define Social Security. So under the Social Security Act, you're disabled if you cannot do the work that you did before because of a medical condition, you can't adjust to other work because of your medical condition, and your disabling condition has lasted or is expected to last at least a year or end in death. Right? Now, the process, I'm going to pull all of these up so that we see the full picture. Now, the process for determining whether an individual is disabled, Social Security actually serves as the intake. So when a person applies for disability, we're gathering all that information, and then the DDSs, or the State Disability Determination Services, actually makes our medical decisions for us. And one of the things that they're going to want to know about, as well as what Social Security is going to want to know, is, are you working? Before an individual can be determined to be disabled, they have to meet what we call our non-disability requirements, and one of those is working. You'll see here, they have the substantial gainful activity amount shown. Each year, Congress sets that dollar amount. If an individual is applying for Social Security disability benefits, if they can earn more than that substantial gainful activity limit, they're not considered to be disabled. And we would do a technical denial in-house. It would not even move forward for a medical decision. But if you're not working, or if the individual is not working, and we gather all the information, send it to DDS, they're going to look at, again, the work. They're going to look at the severity of the condition. They're going to look to see if those alleged disabling conditions fall under our list of disabling conditions. They're going to look to see if, based on those conditions that are alleged, if the individual can go back to doing the work they were previously doing. If not, are there other types of jobs that this individual could possibly do with the disabling conditions? Now, Social Security administers two disability programs. One is Social Security Disability, or SSDI. The other is Supplemental Security Income, or SSI. With both programs, we pay a monetary benefit to individuals that meet our definition of disability. Social Security does not pay a partial or short-term disability benefit. Now, there is the possibility that an individual could be receiving both SSI as well as SSDI. It just depends on the financials. And with SSDI, or with Social Security disability, we can pay other family members of the disabled individual on their record. Those family members that we can pay, it's not going to affect the disabled individual's benefit amount. It's not going to reduce it in any way. We base the amount that we pay the individual, the disabled individual, on their average lifetime earnings. So we're going to look at those total earnings on their work history, and that benefit is going to be calculated based on the average of those lifetime earnings. As long as the individual is considered to be disabled, those benefits will continue, right? So every year, well, not every year, I'm sorry. Depending upon the medical condition, is going to determine when we do our reviews. So we're going to do what we call continuing disability reviews, or CDRs, on individuals at certain time periods, depending upon that condition. So the review could either be every year, every 3 years, every 5 years, every 7 years, depending upon the severity. There are some conditions where there is no likelihood of improvement, so there would be no review. So again, depending upon the severity of the condition, it's going to determine how often that claim is reviewed to determine if the individual is still disabled. But as long as they're considered to still be disabled, those benefits will continue. Now, I mentioned a little earlier that we can pay certain individuals on the disabled workers record. One of those is going to be the spouse. Not all spouses are going to be eligible, but some spouses that are over the age of 60 could possibly receive benefits off of the disabled workers' disability record. We would have to look at whether or not that spouse has benefits of their own, if that spouse is working. Those kinds of things are going to be, used to determine if benefits are going to be payable. We can also pay a young spouse, younger than the age of 62, if that young spouse has a child of the disabled worker in their care that's under the age of 16 or is disabled. Once that youngest child turns 16, the benefit for that young spouse would stop, but we'd continue to pay that child until that child is age 18 or 19 if it's still in school. We're going to talk about the child right now. If that child is the natural, adopted, step, or grand, right, we could possibly pay them benefits on that disabled individual's record. We can pay a stepchild on the record if we can determine that the disabled worker has been providing at least 1/2 financial support to that stepchild. We have a list of questions and proofs that we need to show that that 1/2 support has been met. We can pay a grandchild on the record only if both parents of that child are either disabled or deceased. Now, that child has to be unmarried and under the age of 18. We can pay a child beyond the age of 18 if that child is still in high school full-time. We can pay up until actually 19 and 2 months, or high school graduation, whichever comes first. We can pay a child beyond the age of 18 if that child has been found to be disabled through one of Social Security's disability programs, and that child's disabling condition began prior to them turning age 22. Now, for Social Security disability benefits, to see if a person is eligible, we're going to look at 2 different earnings tests. We're going to look at the recent work test, which is based on the age at the time of disability. And then we're going to look at the duration of work, which is going to show us how long the individual has worked under Social Security or had those earnings that FICA taxes were withheld from. The tests are based on credits. So everyone that works and they have Social Security earnings, they're earning credits. You can earn 4 credits in a year. Each year, Congress sets a dollar amount that a credit is going to be worth. In 2023, that amount is $1,640. So once you've earned, I think, $66,560, you've gotten your 4 credits for the year. Right. So we're going to be looking at duration, and we're going to be looking at the recent work. So you see here, if an individual becomes disabled before age 22, then they generally need about 1.5 years of work, which is 6 credits, right? Within the 3 years prior to their becoming disabled. If an individual becomes disabled between 24 and 31, they need enough credits for half of the time between age 21 and the age that they became disabled. So if we had an individual that became disabled at 27, from 21 to 27 is 6 years, they'd need 3 years of earnings prior to the onset of their disabling condition. If an individual became disabled 31 or later, they'd need 20 credits out of the last 10 years, or we say 5 years out of the last 10 years prior to the disabling condition beginning. With the duration of work test, we're going to be looking at, how many years do you have, right? If you became disabled before age 28, you need 1.5 years of Social Security earnings. If you became disabled at 42, you need 5 years of Social Security earnings, and so on and so forth. Now, there is a waiting period for Social Security disability benefits. There's no waiting period for SSI payments, but there is a waiting period for Social Security benefits, and that is a 5-month waiting period. So it's 5 months from the established onset date. So when we're gathering the information in the application, we're going to ask, when did you become disabled, right? So the individual tells us when they became disabled. That is their alleged onset date. Once DDS makes their decision, they provide us with the established onset date, and that 5 months is from the established onset date. So the actual benefit is going to be paid after the sixth full month of being eligible for the disability benefit. There are some exceptions to that rule. If we are talking a disabled adult child, there is no waiting period. And if you were previously entitled to disability and for whatever reason were found to be no longer disabled, but you reapply, there is not you don't have to go through another 5-month waiting period, as long as you become disabled again within a 5-year period. Now, for SSI, SSI is a federal needs-based program. So when we're looking at individuals that are applying for SSI payments, we are looking at their income and their resources. So you have to have limited income and resources in order to be eligible for SSI payments. Now, we pay SSI for a number of different reasons, not just disability. So we pay an aged SSI benefit. That's for individuals that are 65 or older. We can pay SSI based on an individual being totally or partially blind. We can pay that adult disability benefit through SSI if the individual has that, the limited income and resources. And we can pay children under the age of 18 a disability benefit, SSI disability benefit, if they have a mental or physical impairment that affects their functioning. Every year, Congress sets the federal benefit rate. That is the maximum amount that can be paid on SSI. 2023, that federal benefit rate for individuals is $914. If it's a couple, an eligible couple, and an eligible couple is where both spouses are eligible for SSI, then that federal benefit rate this year is $1,371. Now, in order to qualify again for SSI, you have to have the limited income and resources. So income can be either earned or unearned. Right? Your unearned income is going to be your wages and your self-employment. Here you see a few examples of unearned income, any other Social Security benefits, your pensions, your VA benefit, the value of items that you get from other people, like food and shelter. We place a value on those things that you receive from other people, and that value will be put towards those income limits. You have to also have limited resources. Resources can be either included or excluded. The resource limit for an individual is $2,000. So that means an individual applying for SSI cannot have resources that exceed $2,000. Resources are going to be things like money in the bank, your bank accounts, your IRAs, your CDs. It's going to be property that you own. It's going to be vehicles that you own, life insurance policies that have cash value, burial plots, those kinds of things. So the things that we would exclude are going to be that property that you live in. So if you own a property that you're residing in and you own another property, we're going to count the value of that other property towards that $2,000. If you own more than one vehicle, we will exclude one vehicle, but we're going to count the value of any other vehicles towards that resource limit. So if you have, at the initial application point, if an individual has resources that exceed those limits, they're not going to be eligible for SSI benefits. That application is going to be denied in-house on a technical basis. If you're a U.S. citizen living in the 50 states or the District of Columbia or the Northern Mariana Islands, you can apply for SSI. But some lawfully permanent residents can also apply for SSI benefits. Now, in most states, your application for SSI is your application for Medicaid, right? If you become eligible for SSI payments, you're automatically eligible for the Medicaid benefit. But in those states where it's not an automatic thing, when you apply for SSI, it's not going to be your application for Medicaid. You would have to go and actually apply at another location for the Medicaid benefit. But that Social Security representative should be able to let that individual know where they can go to apply for the Medicaid benefit. I'm going to pull all of these up as well so we can look at them all. Now, when you apply, or when an individual applies for Social Security benefits, again, we have those three pieces. We have the actual application, we have the disability report, and we have the authorization or the consent to release information. We need all three of those pieces, right? Social Security is just gathering the information. So in preparation for the application process, individuals need these things that you see listed here. They need to know the Social Security number, have to have a social. We don't need to see proof of age, but we do need that birth date in the application. We see if it matches what we have in our system. If it doesn't, then we'd recontact to see if we need something. But most times it is matching for us. In that disability report is where you're going to list, or where they would list, all of those medical sources, all those healthcare providers that they've seen. We need the names, we need the addresses, we need the phone numbers. We need to know when you first saw them, when you last saw them. Do you have another appointment scheduled with them? What tests did they run? What medications did these providers prescribe? We don't need for the applicants to provide us with medical records, but that we do need for them to provide us enough information so that we can request them, or that DDS can request those medical records. That consent, that last piece of our application, that consent to release information, that is giving us the authorization to ask for their medical records. Also within that disability report, we're going to be asking about a work history. Because you remember our definition, a portion of the definition is that you, because of your medical condition, you're not able to do the work that you used to do, and you're not able to do any other type of work. So we need to know that work history. We're going to ask you to give us a work history. What were you doing? Were you able to lift? How much were you able to lift? So it's going to go through a lot of different pieces in that application path. But we're also going to ask about education. We're going to ask, what was the highest grade you completed? Did you do any vocational trainings? Do you have any special trainings? Because we need to know, are you able to do something else, right? The W-2 and the tax information, there could very well be a need for that when we're determining, if you have enough credits. Are you going to meet those 2 work tests that we need to make sure you meet? Now, how to apply for your Social Security disability benefits. You can apply online. I would encourage, if an individual is comfortable applying online with our application, they can do it from the comfort of their home. They don't have to go into the office to deal with the people. If they need to leave it and come back, we provide a reentry number, so nothing is lost. You can just pick back up where you left off, or go back to something that was already done if you need to revisit. If an individual is not comfortable with our online application, my next suggestion, of course, would be to file over the phone. You could call our 800 number that you see here, the 1-800-772-1213, schedule that appointment, someone from Social Security will call at a designated date and time, take that complete application over the phone from the comfort of your home. If, the individual is one of those that, just wants to have that in-person interview, I would still suggest calling that 800 number and scheduling the appointment for the in-person interview. I would not suggest that anyone just shows up at their local Social Security office without an appointment to file for a benefit. If they decide to, please let them know to go with the expectation of a very long wait. Now, we have what we call compassionate allowance cases. So it's very important that when an individual is filing or completing an application for disability benefits, that they list for us everything that's wrong. In some cases we have, individuals that have conditions, but that's not what's bothering them right now. So they don't list it, but that could have been the condition that gets them approved, right? So we ask that everyone, list all of their conditions. If they're doing it online, if one of our representatives is taking their application, we're going to try to pull out, what all is wrong with you. Tell me everything that's going on. Because one of those things could be on that compassionate allowance list. And what that compassionate allowance is that those are those conditions that have a higher likelihood of approval, right? And so with those, if those are listed in the application, they're automatically flagged at DDS. So DDS is going to expedite the processing of those applications. Normally it takes about 3 to 6 to 10 months for the application to be processed. If it's a compassionate allowance case, it is a much quicker processing time. Now, once DDS makes their decision as to whether or not the application is approved or denied, the applicant does receive the notice. If the application is approved and it was a Social Security disability application, that application is going to reflect the benefit amount and when to expect that first payment. With some SSI applications, those approval letters are not going to reflect that information. Because SSI is that needs-based program and it is dependent upon the income and resources, and because those applications, that process can take months, there sometimes is a need to recontact the applicant after we get the approval from DDS to make sure that the income, resources, and living arrangement has not changed within the time that it took for the application to be approved. But after the recontact, if it's necessary, they will get a subsequent notice that's going to have, that information, the benefit amount, the payment start date, and how the benefit amount was figured. If the application is denied, they'll receive the denial notice. It'll have the reason that the application was denied, and it also provide the appeals rights. Now, your My Social Security account, I'm hoping that most everyone on the call has already set up your own My Social Security account. But the My Social Security account is huge. It's like the gateway to the majority of Social Security's online services, even the online application. You have to have a My Social Security account in order to apply online. So there's a number of different things that an individual can do with their My Social Security account. If you're not yet receiving any benefits from Social Security, you can get those retirement benefit estimates. We provide, what you could receive at 62, full retirement age 70. We now have redesigned the online statement to where we provide those estimates from age 62 through age 70. So you don't have to necessarily use our calculators. You can see what your spouse could receive in benefits on your record if they're eligible. Sometimes folks need proof that they're not yet receiving benefits from Social Security. You can get a letter to that effect. If you have an application or an appeal pending with us, if you have your My Social Security account, you can check the status of those of that application or appeal online versus having to call or go into the office to find out what's going on with the application. You can get that online statement. We used to mail the statement out every year. We stopped doing that some years back. Now we only automatically mail it to individuals over the age of 60 who are not enrolled in a My Social Security account. So if you're not over 60, the only way that you can see that statement or that information that was on the statement that we used to mail out is if you have a My Social Security account. If you're already receiving benefits or if you're already enrolled in Medicare, you can make some changes to your record if you have that My Social Security account. You can change your direct deposit, your phone number, your address, get a replacement 1099, a replacement Medicare card, a replacement 1042S if you have self-employment. If you're tired of receiving all those mailed notices from Social Security, you can opt out of the mailed notices and receive those notices online. Print out that benefit verification letter showing how much you're receiving from Social Security, and you can access the representative payee portal. We also have new advanced designation of representative payee, where individuals can tell us either at the point of initial application or behind their My Social Security account the names of and phone numbers of 3 individuals who they would like to be their representative payee should they ever need one. So it keeps the benefit from having to be in suspense for months while we have, look for a representative payee for them. You may never need that option, but it's good to have it than not. And with that, I believe that's my last slide. Yes, it is. And so if there are any questions, please put them in the Q&A. I'll go in and answer, provide you an answer to them. Thank you so much.
All right, thank you so much, Tanya. We've got some good questions that have come in through the Q&A. All right, let's take our first knowledge check. So question 1, what factors determine the amount of the monthly cash benefit for SSDI? So there's a single choice here. And let's start the timer here. It's A, none, it's a fixed amount updated each year by Social Security. B, none, because it's a fixed amount that's updated each year by your state. C, your locality, or D, your average lifetime earnings. Okay. Let's see what the answer is. Well, a majority of you have thought it's D, your lifetime earnings, and that. We've got some questions, we've got some answers about maybe no, it's a fixed amount. So let's see what we have here. You're right, D, your average lifetime earnings is the correct answer. All right, let's move on. I'm going to transition this over to David Sandana, who will be presenting lessons 2 and 3.
Thank you so much, Sylvia, and hello and welcome back, everyone. The next section of this presentation will focus on 3 things. Medicare for people who are eligible for disability benefits, specifically for those who are under 65. We also gonna look at the plan choices those individuals have when they become eligible for Medicare under 65. And lastly, we're gonna look at other programs that are available to people who have disabilities, specifically those who have limited income and resources. So the main objectives of this lesson is to list the requirements to qualify for Medicare based on disability, and also explain retroactive entitlement to Medicare. So Medicare for people under 65, they're mainly covered 2 groups of individuals, and probably the vast majority of you are familiar with those individuals who qualify for Medicare because they qualify for Social Security disability benefits. And you heard from Tanya's presentation, the requirements the Social Security have for those individuals who apply for disability benefits. Now, when you do get to the point that you start receiving that cash benefits from Social Security, 24 months later, you become eligible for Medicare and therefore automatically enroll. And we'll talk a little bit more about the Medicare enrollment and the timing and such. Now, also individuals who are diagnosed with end-stage renal disease, regardless of their age, may qualify for Medicare if the individual itself, a spouse, or a dependent individual of a working person has the required amount of work credits. You heard Tanya mention the requirement for work credits and the fact that individual usually needs at least 6 credits to qualify for benefits, right? On their Social Security, depends on their age. When we talked about end-stage renal disease, the individual needs at least 6 credits within the past 3 years before they become disabled. Now, entitlement to Medicare or effective date for Medicare based on end-stage renal disease varies dependent of whether the individual is receiving regular course of dialysis or they may jump in to receive a kidney transplant. Unlike Medicare for people with disability that get automatically enrolled, individuals who get diagnosed with end-stage renal disease and qualify for Medicare are not automatically enrolled. So they have to file an application. They're not required, however, to file an application. And so it is up to the individual to enroll when they become eligible. And again, the effective date will depend on whether the individual, for example, get a regular course of dialysis. It's usually the first date of the 4th month they start dialysis, or the first month they start dialysis if they participate in the training. They can get Medicare the first month they get a transplant, or the first day they get admitted in the hospital to get a transplant, assuming that the transplant is going to take place within the next 2 months, or 2 months prior to the month of the transplant if it takes more than 2 months after the individual going to the hospital. So again, I just wanted to briefly mention the effective date for both individuals who are getting Medicare because of disability or because of end-stage renal disease. From this point forward, we'll focus the presentation a little bit more towards those who are getting Medicare because of disability. Now, you heard this from Tanya's presentation, but typically an individual has a 5-month waiting period after the disability onsets. So that puts and then after you receive the cash benefits, then the 24-month start. So the individual typically will get Medicare in the 30th month after they became disabled, after that disability onsets. Now, there are 2 exceptions to that rule. And again, you heard Tanya mention about the waiting period doesn't apply to individuals who get childhood disability benefits. That 5 months they have to wait to get the cash benefits do not apply if that individual was receiving childhood disability benefits. So that tells you right there, after hearing Tanya's presentation, that the earliest possible age that an individual qualifies for Medicare based on disability is at the age of 20, right? Because once that individual turned 18, that child that may have been getting child's benefits under the parents because either the parent was receiving retirement, disability benefits, or the parent may have been deceased. If that is the case, the child, once they turn 18, Social Security determine whether that child is disabled, and they will use the same category as an adult. And if it does, then the 24-month waiting period starts right there. So the earliest possible date would be the age of 20. And also those individuals who were getting, who were previously entitled to Social Security disability benefits in the past 5 years, and then they reapply. That 5-month waiting period will not apply to those individuals. Also, individuals who are diagnosed with amyotrophic lateral sclerosis or ALS do not have to wait the 24 months before they get Medicare. So the moment they start getting the Social Security benefits, they will also get automatically enrolled in Medicare. Now, when we talked about the 24-month waiting period, and again, Usually you will get automatically enrolled in Medicare in the first stage of the 25th month after you waited that 24th month, right? So if you're getting disability benefits, you can enroll in other healthcare programs within that 24-month waiting period. So you can either apply for Medicaid, and you heard Tanya mentioning the fact that Medicaid and Social Security kind of work hand in hand when determining eligibility based on disability, specifically the states that use the SSI criteria, or they rather enter into an agreement with Social Security. Those are called 1634, and that refers to the section in the law that authorize the agreement between the states and Social Security, whereby when Social Security determined that the individual is eligible, for example, for SSI, that would confine eligibility for Medicaid as well. And we have about 34, I think 34 states plus DC use that, have that agreement with Social Security to get, so once Social Security determined SSI, those individuals are automatically eligible for Medicaid. Even those states that do not use don't have that agreement with the states, they do have to take into account a few things. For example, if at least one of the criteria is more, it requires more than SSI, is more restrictive than SSI, then that states have to make sure that they have what we call the Medicaid spend down, that they take into account the healthcare expenses to determine whether that individual qualifies for Medicaid. So definitely Medicaid is an option there. In the event that the individual do not qualify for Medicaid, Medicaid, well, they will file one application, and then if they don't qualify for Medicaid, they may look to see if they qualify for a health insurance marketplace, and possible qualify for premium tax credits and co-sharing reduction out of pocket. So typically the individual may just file one application that will determine whether they qualify for Medicaid or they qualify for premium tax credit. They could have that, specifically if they qualify for premium tax credit to the marketplace, they'll have that until they get automatically enrolled in Medicare 24th month later. Once that happens, of course, the individual will transition to Medicare, and then the premium tax credit and co-sharing reduction will end at that point. Now, there are some cases that you heard Tanya mentioning about the time frame that it takes Social Security to process. Let me go back in here real quick to process the disability cases. So there are some instances that Social Security may take longer to process or to make the decision about disability. For example, if the individual, if they originally denied and they file an appeal, if it takes longer to process the application, usually longer than 3 months, your disability, usually your disability benefits is retroactive to that onset date, the day that you allege that you became disabled. If that happens, Medicare will also be retroactive to that 25th month after you start receiving your check. So you do get Medicare the 25th month after you get your check. Usually Part B coverage start with the first month that you get Part A, with one exception. If, for example, it has been more than 5 months, or it will be more than 5 months retroactive, what Social Security does, and instead of putting Part B retroactive to Part A, is that they would enroll the individual effective date for Part B the month they make the determination, and then we'll send a letter to the individual indicating that they have the option to take Medicare Part B back to Part A, provided that they let Social Security know within the next 2 months, usually 60 days, and they agree that that premium, that they will have the premium, the back premium paid through their deduction, through the Social Security deduction. Now, with regards to disability and Medicare entitlement, it's something that we don't cover during the first part of the presentation, but an individual who is considered disabled and go back to work, Social Security have many programs, train individuals and go back to work. And if they do, there are many incentives that they provide to those individuals. And one of them is to keep Medicare premium-free Part A for the next 8.5 years. So for as long as that person continue to work and make more than the substantial gainful activity that you learned in the previous slide, it's not that the individual is no longer disabled, the individual is still disabled, but they went back to work and they're making more than that that limited amount that is set in the law. They will be able to retain Medicare premium-free, Medicare Part A premium-free for the next 8.5 years. After which time, if that individual is still considered disabled and is still working, and they are not yet 65, they will be able to purchase Medicare Part A. If they purchase Part A, they could also purchase Medicare Part B. They cannot have Part B only, right? So after the Part A premium-free terminates, they can purchase Part A, and along with Part A, you can have Part B, but you cannot just have Part B under the working disabled provisions. Now, the reason for Medicare entitlement when that individual turns 65 changed from disabled to an age individual. So at that point, that individual will have a brand new initial enrollment period. So that's another opportunity they have. For example, if they didn't enroll in Part B, if they were paying a penalty for Part B, that penalty will go away automatically. If they were not enrolled in Part B, they will be enrolled in Part B automatically. And then they will have an opportunity to decline Part B if they so choose. But again, this is a brand new opportunity or brand new initial enrollment period. If they had for example, a Medicare Advantage plan or prescription drug, they want to change, they could do it during this time. If they have a Medigap policy, they have a brand new open enrollment period that begins 6 months when the individual is both 65 and enrolled in Part B. So if they had, for example, a Medigap policy that was only authorized by the state, we'll talk about Medigap policy in a minute. They have this brand new open enrollment period. They can choose any Medigap policy in the state probably at a better price. So a lot of things happen once the individual goes from disability to age. In the event that an age individual later become entitled to Medicare, eligible for Medicare because they develop end-stage renal disease, also know that that will provide an individual with a brand new initial enrollment period, even if they are over 65, because they are diagnosed with end-stage renal disease. So that may be another opportunity an individual may use to adjust their coverage. Now, and Sylvia, we have the first knowledge questions here.
That's correct. Thank you so much, David. Okay, let's check your knowledge here and see if you've been paying attention. All right, the question is, James became entitled to SSDI at 60 and Medicare at 62. He didn't take Part B when he was first eligible and didn't have employer coverage. He automatically gets Part B during his initial enrollment period when he turns 65. How much is his Part B late enrollment penalty? All right, let's select. Do you think it's A, 5%, B, 10%, C, 10% for each 12-month period without Part B, and D, no penalty? And the answer is D, no penalty. You're correct. All right, David?
Well, thank you, Sylvia. So as I mentioned in the beginning, individuals, when they become eligible for Medicare because of disability or because of they have end-stage renal disease, they also have choices in terms of how they get their Medicare coverage. They have, I'm gonna skip this slide and just go right into the choices that folks have. So for example, of course, when they enroll in Medicare, they have a choice to stay in original Medicare. They also have the option once they enroll in Medicare during that 25th month. They have the option. They have initial enrollment period to enroll, for example, in a Medicare Advantage plan or other Medicare health plans offered in their area. They also have the option to enroll, stay in the original Medicare, and enroll in a Medicare drug coverage to add to the original Medicare, or join a Medicare Advantage plan with which have a prescription drug plan that goes with it. In other words, when the individual become eligible for Medicare under 65, they have mostly all the choices that you would have when you get Medicare for the first time when you turn 65. So it's really not much of a difference there with the healthcare coverage choices. Now, one of the areas that we get a lot of question is about coordination of benefits for individuals who get Medicare under 65. And I think when we talked about coordination of benefits and we think about Medicare enrollment for people who are under 65, there seems to be a little bit of confusion there when we're trying to separate special enrollment period with the coordination of benefits. So let's start with coordination of benefits and say, if an individual under 65 eligible for Medicare with disability is working, we look at the size of the employer to determine whether that employer would be primary to Medicare. If the employer has more than 100 employees or is working for an employer who is a member of a multi-employer plan where one of the employees have more than 100 employees, that employer plan is primary to Medicare. So again, we'll look at the size of the employer, and it usually have to be more than 100 employees for that plan to be primary to Medicare. And this is whether the individual itself working or is covered by a spouse or as a family member. You heard how family members can qualify under an individual. For example, if it's a disabled adult child that is covered, for example, under a parent health insurance plan. So again, we look at the size. Now, when we think about Medicare special enrollment period and individual who get Medicare under 65, if the individual itself or a spouse are working for an employer, regardless of the size of the employer, that individual do not need to be enrolled in Medicare Part B. They qualify for a special enrollment period for as long as they're covered by that group health plan, regardless of the size. However, what is different is that if you are getting health insurance as a family member older than the spouse, then that's where we looked at the size of the employer. So if the employer has more than 100 employees, that disabled individual covered as a family member older than a spouse qualify for a special enrollment period. But if that employer plan goes down below 100, then that family member would have a special enrollment period that we begin when the plan dropped the size under 100 to enroll in Medicare. From that point forward, they would have 8 months to enroll in Medicare. If they don't enroll around that time, that means that if they wanted to enroll later, they're not yet eligible for Medicare because of age, they have to wait until a general enrollment period and possibly pay a penalty. So this is the area that sometimes we find that folks confuse the size of the employer for the purpose of Medicare coordination of benefits, and the size of the employer for the purpose of qualifying for that special enrollment period. And I hope that clarifies that. Now, when we talk about those individuals that are covered by a plan based on retirement, you could always assume that if the individual is retired, that plan will be primary to Medicare. You could almost always assume that that would be the case. When the individual is enrolled in Medicare and have these plans, if they're able to keep those plans into retirement, it's great, because typically those plans wrapped around Medicare to help them with the out-of-pocket expenses, withdrawal coverage. Those plans have, most of these plans have routine dental care, and things that are usually not covered by Medicare. Now, the only instance that you may see a retired plan paying primary to Medicare is if the individual, for example, develop end-stage renal disease. So let's say that an individual retired at the age of 62, and they had their employer plan based on retirement. If that individual develop end-stage renal disease and become eligible for Medicare, there will be a 30-month coordination period that is start from the moment the individual become eligible for Medicare, whereby that plan will be primary to Medicare. And this is regardless of, whether the individual is actively working, is retired, and whether the individual is working for the large or small employer. So that is the only instance, again, that you may find a retired plan paying before Medicare. That is because of the 30-month coordination period for end-stage renal disease. Now, with regards to Medicare supplement insurance, Medigap policy for people under 65. So federal law does not require Medigap plan to be sold to individuals under 65, whether you're getting Medicare because of a disability or because of end-stage renal disease. However, you can see in there that there are many states, as you know, the state have more flexibility to go beyond what Medicare offered. So there are many states that provide at least one kind of Medigap policy for people who are under 65. So, they may be requiring that the Medigap policies offered in the state may just offer the very basic Plan A benefits for those of you who are familiar with Medigap policies. Now, and the note on the bottom of the slides points out that although the states may be requiring one of the Medigap policies to be sold to people under 65, there's some of the states that just require the policy to be sold to an individual who have Medicare because of disability, and there may be states that says we're only requiring a Medigap policy to people who have end-stage renal disease. So it's important to check with the state to see what kind of options there are for people who are under 65. And we came upon another knowledge check. Sylvia?
All right, these knowledge checks are really keeping you on your toes here. All right, let's listen. Question 3 here. Generally, in which situation would Medicare be the primary payer? All right, Dave, let's start the timer. Do you think it's A, when you have retiree coverage, B, when you have Medicare due to disability and current active employer coverage through an employer with 100 employees or more, C, all of the above, or D, none of the above? The answer is A, when you have retiree coverage. Generally, that's going to be the situation in which Medicare is the primary payer. All right, David.
Thank you so much, Sylvia. And yeah, I hope that that with that question kind of helps everyone who may have some other questions about about coordination of benefits. That remember, when you have a retiree plan, almost always Medicare is going to be primary to that plan. When we talked about an individual under 65 receiving disability benefits through Medicare, we'll look at the size of the employer to determine whether Medicare is primary or secondary. If you have more than 100 employees, that plan is primary to Medicare if you get a Medicare because of disability. Now, for those individuals 65 years of age and over and covered by an employer plan, the employer plan just need to have less than 20 employees for Medicare to be primary. If they have more than 20 employees, then that plan is primary to Medicare. We do have another presentation coming up through this series of workshops that we're doing, that it talks specifically about coordination of benefits for those of you who may want more information about coordination of benefits. Now, I mentioned in the beginning that there are other programs for people with disabilities, specifically for those who have limited income and resources. So those programs, as I mentioned before, include the Medicaid program. And again, individuals who are disabled, if for any reason they don't qualify for Social Security, supplemental security income, or they don't qualify for SSDI, they can still apply for Medicaid as a non-catch individual, and they may potentially get Medicaid because of disability. There's also, of course, the Medicare Savings Programs, which is a state program to help people who are enrolled in Medicare, mainly that they are enrolled in Medicare Part A. They can help them with the Medicare premiums and out-of-pocket expenses, depending upon their income and their resources as well. So that program also helps for Medicare expenses. And of course, we do have the extra help benefits for those individuals who have limited income and resources, to help them with prescription drug benefits as well, out-of-pocket expenses. There's some individuals with very limited income that may pay, they may not have to pay any premiums, and they may have to pay very little out-of-pocket expenses when they go to the pharmacy. Typically, when the individual is eligible for SSI, they're eligible for Medicaid or Medicare savings programs, they automatically qualify for extra help. If the individual don't already qualify for SSI, Medicaid, Medicare savings program, they can apply for extra help, primarily through Social Security, or they could do it through the state. The next couple of slides just basically go through a series of resources to help you with more information. We have our website listed in there, the Medicare.gov, which is for the Medicare, primarily for Medicare beneficiaries, CMS.gov, Medicaid.gov. We also listed Social Security, Department of Labor, and such. We also have some publications also with basic information about Medicare. And we also listed a group of publications from Social Security that may help you with more information about those programs that we just addressed. And with that, Sylvia, I think we're ready to take some questions.
You're right, David. All right, we had a couple of great questions that came through, and then I'm going to kind of see if we can kind of work with you and Tanya to kind of get some. So the first one here is it possible to work part-time while receiving SSDI? If so, is there a weekly hour limit or monthly earnings limit? Tanya?
Okay, so yes, it is possible to work while receiving SSDI benefits, but it's not about the amount of time that you work, it's about how much you earn. It's always about that dollar amount. So it depends on how much you earn, and every year Congress sets what's called the substantial gainful activity amount. And as long as you're working and earning under that limit, then you're eligible for the benefit for the month that you earn it. So with Social Security disability benefits, we're looking at monthly. So it's every month we're going to look at, what you're earning in that month. So if for a month you earn under that substantial gainful activity limit, you're eligible for the benefit for that month. If you earn over that limit, depending upon where you are in your disability, because with Social Security disability, even though the programs are figured the same way, we look at with SSI and SSDI, we look at them differently when it comes to work. So for SSDI, you can go through what's called the trial work period. It's a 9 to 11 months because you get 2 months grace period. There's a 9 to 11 month period where you can work once you've been receiving SSDI for at least a year. You can work and earn whatever. It's the trial work period month. It's to see if you can get back out there and start back paying into the trust fund on a regular basis, right? So for that period, you can work and earn whatever you want and still receive all of your benefits from Social Security. After that 9 to 11 month period, you enter into what's called the extended period of eligibility, or the EPE. And that's a 36 month period where you can go in and out of pay depending upon what you earn. So if you earn under the substantial gainful activity amount, you're eligible for the benefit for that month. If you earn over, you're not eligible for that month. And that can go on for 3 years, for 36 months. The month after that 36 month period, if you earn a penny over that substantial gainful activity amount, your benefit stops. So again, it's not about how many hours you work, it's about how much you earn and where you are within that disability period. So again, 9 to 11 months, earn whatever you want after you've been eligible for the benefit for at least a year, because you got to remember our definition is that you have this disabling condition that prevents you from doing the work that you're doing, that you can't do any other work. And that condition, it has lasted or is expected to last at least a year and end in death. If you go back to work within a year, we're going to say, and you're earning over that SGA amount, we're going to say, well, maybe you weren't really disabled to start with. So it's really important. Don't go back to work before that year. But after that year, you can do that trial work, earn whatever you can, see if you can get back out there in the working world. Once you end that trial work period month, you enter into that 36 month extended period of eligibility where you can go in and out of pay. But after that 36 months, if you earn over that SGA amount, then the benefit stops.
Oh, thanks so much, Tanya, for the detailed explanation. So again, really mark your calendars to know really the key timeframes. All right, we got a question here. Somebody ran across a case where somebody had Medicare and they were a child. Can you clarify in which situations a child could qualify for Medicare? David or Tanya, do you want to take a stab at it?
That's all you, David.
So thanks, Tanya. So what I mentioned was that the earliest possible age that an individual could get Medicare based on disability is at the age of 20, right? So you could be receiving child's benefits under your parent, and Tanya can talk a little bit more about that. But so before you turn 18 and your parents, for example, your parents pass away or they're collecting retirement of disability benefits, it is possible that a child could be receiving benefits under that parent as a child. Once the child turned 18, then Social Security determined whether that child meet the definition of disability. And then if they do, from that point forward, they don't have to wait the 5 months to keep getting those benefits. But from that point forward, then the 24th month start counting. And then the earliest possible age will be the age of 20. So that's the earliest possible age you get Medicare based on disability. With regards to end-stage renal disease, is an individual at any age when they're diagnosed with end-stage renal disease, and the individual itself has at least 6 work credits within the past 3 years, or is the spouse or a dependent person, a dependent child of that individual who meets that work credit requirement. And you could talk a little bit more about, Tanya, about when the child could qualify on their parent record and such.
I think you did a great job.
Thanks.
All right. We got a couple of questions that came through the Q&A talking about cars or multiple cars that have been counted against their resources. Tanya, can you just give a quick explanation about what counts as a resource when calculating SSI qualifications?
Okay, so like I mentioned that we have with resources, we have those resources that are included that we count towards that resource limit, and we have those resources that we exclude. Like if you have, more than one property, the home that you're, or the property that you're living in, we're going to exclude, but we're going to count the value of that other property. Kind of the same with vehicles. We had our policy changed back in 2005, where now we're going to exclude, we're going to exclude only one vehicle per household. Right. So I know someone asked the question that if you have, if it's a couple that's eligible and there are two vehicles, are you going to exclude two vehicles because there's two people? Well, with the new law, no, we're going to look at the household. So we're going to exclude only one vehicle from the household, and the other vehicle, as long as it can be used for transportation, it's going to be counted towards that resource limit. Right. So even if it's, 20, 30 years old, if you can still get around, someone put something about farm equipment or that they were using just around the farm, it can be still used. It's still operational. We're still going to count it towards that resource limit. If it's not that, we're going to exclude the one that has the highest or the greatest equity, and all of the others, or the other one, or whatever, is going to be counted toward that resource limit.
All right, thanks. Yeah, we got a few questions on that, so it's nice to hear that clarification. Okay, another question we got was about Medicare Advantage plans and enrolling. Melissa, I think you might be familiar with this scenario. Somebody who's transitioning from SSI Medicaid to Medicare Advantage plans.
Oh, sure, Sylvia. So the question was really just, well, the way I was interpreting it anyway, the question was about, would someone be eligible for Medicare Advantage? And so what I responded to in the questions was, to be eligible for Medicare Advantage plans, you have to be enrolled in Medicare Part A and B and live in that plan service area. So so long as that person met those requirements, then yes, they would be eligible. So it's not SSI alone, but if you had SSI and were enrolled in both Medicare Parts A and B, and in the plan service area. Thank you.
Thanks so much, Melissa. David, we got a question too about somebody who is transitioning from having end-stage renal disease, but was not sure they would like to join Medicare, but looking at the options of the health insurance market. Can you give us a little insight on whether or not you have to join Medicare if you have ESRD?
That's a great question, and I think when the marketplace started to kind of taking off and people were looking at their option for healthcare coverage, many individuals who develop end-stage renal disease and are signed up for the marketplace, or they looking to buy a marketplace plan, of course, they do have the right to enroll in a marketplace plan if one is available in their area. They could possibly qualify for premium tax credit and co-sharing reduction. So the question is whether that individual is required to enroll in Medicare now that they have end-stage renal disease. So this particular group of people are not required to enroll in Medicare, and they will not lose the premium tax credit and co-sharing reduction if they don't enroll in Medicare. So this is kind of the only group of individuals that could potentially keep premium tax credit and co-sharing reduction, even if they potentially are eligible for Medicare but have not enrolled. So typically, anyone else who become eligible for Medicare, for example, at age 65, and you qualify for premium-free Part A, even if you don't enroll in Medicare, while you enroll in the marketplace, you will lose that premium tax credit and co-sharing reduction. Another group may be those who have to pay premium for Part A. If you do have to pay premium for Part A and you turn 65 while in the marketplace, if you don't enroll in Medicare, you are able to keep that marketplace with premium tax credit and co-sharing reduction, but only if you have to pay premium for Part A.
All right, I'm going to ask 2 more questions and then we'll kind of wrap it up. All right, the first one is, could you explain why there are no penalties for SSDI beneficiary that decides to not accept Medicare Part B earlier than 65?
So there is, we were talking about those who do not enroll in Medicare. So let's say you start receiving disability benefits, you get automatically enrolled in Medicare Part A and B, you get your Medicare card, you decided that you don't want it to pay the Medicare Part B premium. If you do decide not to take Medicare Part B and you want to enroll later, depends on when you decide to re-enroll again. You have to wait until the general enrollment period. And if it has been more than 12 months, then there is a 10% penalty for each 12 months that went by and you could have been enrolled but didn't. But let's say this individual has an employer group health plan. Then of course this individual qualify for a special enrollment period. And I mentioned this special enrollment period and how it applies differently for individuals and a spouse or individuals that is enrolled in that plan as a family member, right? So individual and a spouse could be could have an employer plan of any size and they could forego Medicare Part B, and because they qualify for that special enrollment period, they can enroll at any time while working or 8 months after that plans terminate. If it is a family member older than the spouse, then that individual had to be enrolled in a plan with more than 100 employees to qualify for that special enrollment period. If it's less than 100 employees, that individual may incur penalty if they don't enroll in Medicare Part B when they should have. They can only enroll during the general enrollment period, and it could be a penalty. So that is the distinction between, delaying Medicare Part B enrollment under 65 and working between the individual spouse or a dependent family member.
Along the lines with that, David, one more question came through again about somebody who decides to not elect Part B. So if you're under 65, you've collected SSDI for 24 months and automatically enrolled in Medicare A and B. Can you turn down Part B if you are covered by your spouse's employer plan with less than 100 employees? And would they be late enrollment period penalty when they do enroll? Are they protected from the penalty because they do have employer group health plan? Understand that this might be a Medicare primary payer issue. So just kind of along the lines what you just mentioned earlier.
Right. So the answer to the question is yes. They all qualify for a special enrollment period if they're covered under self or a spouse, even if that plan has less than 100 employees. Now, the dilemma here, however, is that the employer plan will be, Medicare will be primary to that employer plan. So there may be a case where the employer itself, they're the individual, hey, we have less than 100 employees, although you don't have to enroll in Medicare. We do require that if you don't enroll in Medicare, we may pay as if Medicare was primary, right? So that may be that dilemma there that the employer plan may tell the individual, hey, it's up to you to enroll in Medicare, but if you don't, we're gonna pay as if Medicare was primary. Same thing applies, for example, for individual who is age 65 and over and is working for a small employer that has less than 20 employees. That individual is still qualified for Medicare special enrollment period, but the employer could say, now Medicare is primary. If you don't enroll, You don't have to, but we would pay as if Medicare was primary. So those are the two things to keep in mind there.
All right, thanks so much. Tanya, any last minute comments you might want to just kind of encourage or, share?
The last question that I just responded to in the chat, someone asked if a child is receiving benefits off of a disabled parent's record, that child, if I'm understanding it correctly, and the child turns age 18, can the child then receive like an independent benefit, like on their own? For Social Security disability purposes, of course, if a child is not disabled or does not have a disabling condition, then of course you don't apply for disability. But if that child does have their own disabling condition, then we would want to secure an application for that child for both Social Security disability as well as SSI. If that child has some earnings on their own, you could have a child who, had those summer jobs or, jobs throughout the year, and they have enough, according to our 2 earnings tests, and they're so young, they may have enough credits on their own record to be eligible for Social Security disability on their own. But we could possibly, depending upon how much they're eligible for, they could possibly still receive some benefits off of that parent. So if that child was eligible as a disabled adult child for, say, $1,000 in benefits, when we take the application for them on their own, based on their own insured status, if they're eligible for, say, $500, we could possibly pay that additional $500 off of the parent's record still, giving that child, so that child continues to get that $1,000 in benefits. We'd also have that SSI application out there that could, depending upon what the federal benefit rate is, if there's some more that could be paid, then that will come off of the SSI record. Based on that example I just gave, if we're able to pay that child $1,000 combined off of their own and their parents, they would not get an SSI check, with the federal benefit rate being $914 this year. So it just depends on how the dollars look. Again, it's about the money. So it depends on what the dollars look like.
Thank you so much, Tanya. And again, appreciate you really coming in and presenting for us today. David, I got one more question, because it's just a little clarification of what we were talking about with the employee count. What is the difference with less than 20 employees for non-disabled and 100 as being discussed earlier?
So for a non-disabled individual enrolled in Medicare, those who are 65 years of age and over, if that individual is working and have coverage to their employer, if that employer has less than 20 employees, Medicare is a primary health insurance. If it has more than 20 employees, that employer plan is primary to Medicare. But remember, when we are thinking about Medicare special enrollment period, the requirement is that you are covered by an employer group health plan based on current employment, regardless of the size of that employer, right? So if you're 65 and over, you're working for a company that has 10 employees, you could say, okay, I could forego Medicare Part B for as long as I'm working here, and then when that employer terminates, I have Medicare special enrollment period. I can enroll at any time while working, or I have 8 months after that employer terminates. I will not be penalized. There are many small employers that even though the individual is eligible for Medicare, they keep paying their benefits with no change at all. We say they tell them the employee, we'll be fine with you just having our insurance. However, there are some employers that may tell the individual, but we are a small employer, we'd like you to enroll in Medicare. The individual doesn't have to enroll in Medicare. They're not obligated to do so. But the employer do have the right to say, hey, Medicare is primary, so if you don't enroll, we're just going to pay your claim as if Medicare was there as your primary policy. So that's really the difference there. You qualify for a special enrollment period, yes, but if your employer has less than 20 employees, that employer could say, hey, that's fine that you don't enroll, but again, we may not have to pay your claims as a primary. We pay as if Medicare was there. I hope that clarifies that. And again, we do have another presentation that focus specifically on Medicare secondary payer rules. Do you know when that presentation is, Sylvia?
I'll research it right this second, David, and get back to you. It's one of the 12.
So it is coming up. So stay tuned for a presentation just on Medicare secondary payer provisions.
Okay, the last question we got coming in that came in pretty hot was, if a child receives Medicare due to a parent and is disabled themselves, when they turn 18, would they stop receiving Medicare for 2 years until they're 20? And wouldn't their previous disability determination date prevent that gap in coverage?
So again, a child that is receiving benefits under a parent as a child will not be eligible for Medicare, even if that child is disabled. If that child also is receiving SSI, they are under 18, they're receiving SSI as a child. That child under SSI do not qualify for Medicare. So when that child turned 18, Social Security redetermined their eligibility if they're as a disabled adult child after they turn 18. If, as Tanya explained, if they qualify for SSDI based on their own earning records of based on the parents that is already receiving retirement, disability, or is deceased, then at that point there is a 24 months. So at the age of 20, that child may get Medicare automatically. I hope that clarifies that. And Tanya, if you wanted to add anything, feel free to chime in.
No, I think you covered it well. Yeah, if a minor child receiving benefits on their parents' record is not going to be eligible for Medicare. Child receiving SSI benefits is not going to be eligible for Medicare. Medicaid, SSI side, yes, but not Medicare.
All right, well, thank you so much. David, do you have any last minute comments?
No, Sylvia, other than to just stay tuned for the other presentations that will focus more specifically. We have a lot of questions about coordination of benefits. So I think during that presentation, we'll talk a little bit more in detail about Medicare coordinated benefits with other group health plans.
And I've confirmed that that presentation on coordination of benefits is slated for August 1st. All right. That concludes today's workshop, and I want to thank our presenters, Tanya Duncan and David Santana, as well as Melissa Simpson, who helped respond to some of your questions during their presentation. Now you can download slides and materials from our website, the same place you launched this course at the CMS National Training Program website. Finally, you can email us at training@cms.hhs.gov, especially if you get a question that you're not familiar or you want more clarification on. All right, thank you so much, and we look forward to having you participate again. Again, thank you to those who attended today and everyone who's attended some of the other national training workshops. And we look forward to receiving your evaluation so we can start planning for 2024.